A very good morning to you, Naledi, and to our viewers at home. Yes, that court interdict coming as the workers embarked on this demonstration from very early in the morning. Just from yesterday, they were indicating through that press briefing that they're going to be intensifying their strike action. This morning, we saw them do good on that commitment to intensify the strike action as the court process gets underway. And this is where they descended on the Telemukherane Hospital here in the West Rand at Vosloorus. This is one of the facilities that were heavily affected last week by the demonstrations by Nehawu members. They're still here in their numbers, I must say, Naledi, demonstrating under the guard of a heavy police presence. We know very well that this morning as well, we saw the announcement that the army will also be deployed to form part of those that are guarding these facilities. So this morning, where we're coming from, we saw the Minister of Health, Dr. Joe Phaahla, visit this facility here. Alongside him was the MEC of Health here in Gauteng, Nomantonko Maraluhuku. This is where they paid a visit to the facility in terms of facilitating and checking if indeed the delivery of services are not hampered as much as they were hampered here last week. But someone that can give us a sense of what happened during that visit here in the morning by the Minister of Health and the Health MEC here in Gauteng is the acting HOD from the Health Department here in Gauteng, Lisiba Malotana, who joins us now to just give us a sense of the visit by the Minister of Health and the MEC. We know very well that it's coming at the back of that commitment by the Nehawu members to say that they're going to be intensifying their strike action. Welcome to the SABC.
Thank you so much.
So let us in really on what happened here today. We're seeing that the army has been deployed here and there's at least a high police presence outside these facilities. But we saw very well that earlier on in the morning, the health minister and the MEC visiting this facility. What came out of that visit?
No, thanks. The minister and the MEC were really, of course, you know that this was the hardest hit facility last week. Almost at some point it came to a complete standstill. No work was being done. So the assessment over the weekend, of course, we spent the weekend working in terms of planning to ensure that it continues. The minister and the MEC were just to confirm whether or not the service will be rendered this morning. And as you have seen, service have been rendered. There was, of course, a bit of a slow start in the morning with people being delayed to report on duty. But safe to say, I think, as things stand now, the administration part of the hospital has been cleared. Patients are waiting either to collect medications or to see outpatient patients are being seen, and those that are being admitted. I think that's encouraging, and that's what really the purpose of today was about.
We saw very well that commitment from the MEC from last week already in terms of visiting some of these facilities, looking at the interventions that have been put in place by the Gauteng Health, following that interdict that you also imposed on the Nehawu workers in terms of the nature of these demonstrations. Let us in if whether those interventions have really been yielding results. We know that there were teams that were dispatched as well to some of these facilities to try and clear the backlog in terms of the interferences and the disturbances of services emanating from last week's demonstration.
Indeed, I think the court interdict assistance, and I mean, up until Wednesday, there was almost certain areas that were almost dysfunctional. So, and these are one of the hardest hit. Since we got the interdict, I think that also assured staff that the employer is doing the best he can to get people, create a safe working environment, as you can see, so that those that have made the choice to not to participate in the protest and come to work can come to work. It has been going all right, and it's safe to say that all facilities are semi-functional to date. Most of them are open and functioning. Of course, what remains is that the staff is not at the 100%. There are shortages of staff, but we are providing services across all our health platform today. And there are protests at some of the entrances, but luckily, as you see, they are not hindering access and free mobility, which is all what we are asking for.
Did you heighten the deployment of law enforcement because of that commitment by Nehawu announcement that they said yesterday that they're going to be intensifying the strike action? Is this why we are seeing the deployment of the army and just the heightened number of police officials outside this facility compared to last week?
Indeed, I think the police, of course, given the slow start last week in terms of enforcement, the court interdict directs them to actually ensure that access is facilitated. So the police are there for that reason, to ensure that the court order is enforced. But the army are here for a completely different purpose. The army is here because we have since accessed the military health personnel. Wherever you deploy military health personnel, the inventory needs to go and guard and protect them. So there's slightly different reason. But the police are there to facilitate the issues. facilities about the public and the users of the health system to access it.
Dr. Malutana, just your reaction from the latest coming out of the Labour Appeals Court. We saw that court interdict has now been solidified, and this process and this demonstration by public servants, workers, has been interdicted, or at least those that form part of the essential workers. What would be your reaction to this latest coming out of the Labour Appeals Court?
Of course, we welcome the Labour Appeals Court because it's something that confirms last week's judgment that condemns the strike and saying that a due process needs to be followed. And I think now that the certainty provided as far as the Labour Appeals Court, hopefully organised labour will look at that, apply itself and decide probably a different approach needs to be taken on this. We welcome that. I mean, we still have to go into the details, not in our competence, but we welcome it.
Are you able to give us clarity then, just finally, on what was pronouncement that was made by the health minister? We saw also this weekend the Nehawu team just reacting to that, to say they are waiting for the proof in terms of the losses of life or the potential losses of life. We had that 4 people may have lost their lives due to this strike action by Nehawu members. Did the minister touch on that at all? And do we have clarity so far in terms of those investigations into these fatalities?
And I think the word the minister uses is possibly cause of death being linked to the strike. Because of course, every other death that happens in a facility, it's a matter of subject to investigation. So there'll be a process that undergoes. So what were the conditions of the patient? What were the circumstances of death? And the clinical records will then do conclusively what will have then been the cause. But of course, where there was no staff to provide services at the time, one could make those assertions. But I think let's allow the process of the investigation to be concluded to then make some definitive as far as the cause of death in some of these cases out there.
Gauteng Acting Health HOD Elizabeth Malutana, thank you very much, sir, for your time coming through there to give us the latest coming out of the Telemwerherane Hospital. I must say to you, Naledi, it's very, very busy outside this facility here. The police have been deployed here. The army have been deployed here. The members of Nehawu, they've also come out in their numbers to just demonstrate. I'm going to ask my colleague Liepo to just show you what is happening behind us right now. Those are members of Nehawu. They're demonstrating this morning under a heavy police guard. Members of the police from Gauteng have been deployed outside this facility. Now, lady, this is where we saw last week. There were banned tires, barricades going into this hospital. That's prompted the officials from the health department nationally to come down here in Gauteng to try by all means to quell those tensions. But the workers are also saying to us what we're hearing on the sidelines in terms of coming out of Nehawu. They are saying that they are consulting with their legal team in terms of an assessment of this judgment coming out of the Labour Appeals Court, and that's when they'll be able to make a determination of their way forward here. But what we know right now is that the essential workers forming part of this strike action have been interdicted from continuing with these demonstrations. Naledi?
Yeah.